Hello, everyone. I'm Sree Sreenivasan and absolutely delighted to have you all with us for another daily COVID-19 call. These conversations started because I wanted to shoot the breeze since we can't shoot the virus, but they've evolved into something a little more formal so that we can share good, valid, useful information and bring you a conversation that's truly global. In the last few days, we've had conversations such as life in Europe in the middle of the crisis. We've had conversations with doctors. We had a conversation with Andy Revkin about what's happening with the world of sustainability and what lessons can we learn from our fight for climate change. And we had a conversation with Bob Anthony about tech tips. So right now, all of you who are watching, if you would go onto your Facebook, Twitter, LinkedIn, YouTube, find me, and please hit share right now. It's very easy to do. Let as many people in the world who would benefit from this join us as possible. You can hit share, you can tag somebody, you can do all of that. We'd love as many people to watch this as possible. We've had every show, we've had at least 1,000 folks watching at some point, and we'd like to keep that going so we can share this information. All of this is in the run-up to my social media weekend, which is our big event that we do once a year. And it was going to be an in-person conference, but obviously with everything else, we decided to go forward and turn it into an online program. And part of it is we wanted to share what we've been learning from all the time that I've worked online. And so we're trying to show also how to do an online conference. And I hope many people will benefit from that. If you haven't signed up already, you can find the links at the top of my Twitter feed, or you go to smwknd.com, smwknd.com, or the URL you see on your website. I'm going to now introduce you to a group of people who have joined us here today to be part of the conversation. So I'm just going to pull everybody up here. And here we are. First, I want to introduce you to Linda Bernstein. Linda, please wave. And I have Professor Athena Aktipis. Hello, how are you, Doc? And Professor Jeff Gassen. Hi, Jeff. And Dr. Sujana Chandrasekhar. We have 4 doctors, but only one is an MD, and that's Sujana. Everyone else is a PhD, except me, lowly master's degree guy. The rest are all PhDs. Thank you all for being here. We're going to do a couple of different things. One, I just want Linda to tell us how Social Media Weekend is shaping up. It's all day Saturday, live and recorded, so that people from around the world can participate. And if you can't afford tickets to Social Media Weekend, please contact me, write to me. I know these are tough times. I'm happy to give you a ticket in exchange for some volunteer opportunities, either now or later. Main thing is we believe lots of folks will benefit from this conversation and the workshop we're doing. So Linda, go ahead, tell us a little bit, and then we'll go to our other guests.
Well, it's been amazing the past week. We've basically been putting together the live version, not the digital version of Social Media Weekend in the past week, 10 days, and it's really coming together. It's amazing. We have all learned incredible new things about new platforms, about working together, and about working together when we're apart. I mean, I'm used to working with Sree and sitting next to him on a couch. And now we're many miles apart and working on a camera, either on our phones or on our computers. And so Social Media Weekend is just going to be great. In a way, it's going to be, it's going to be different from anything we've done, which makes it very exciting. And it makes it a new experience. And we have terrific guests. And I really think that there's something in it for everyone, whether you're social media oriented, or if you're interested in politics, or if you're interested in new tools to use new tools that will make you be better on your phones or better on your jobs. I mean, it's really, there's going to be a lot of information, and it's a great team. I thank Sree so much for taking the lead here, and Andrew Lee, who's been incredibly helpful, Rajni Menon, and Neil Parekh, and we have a whole team. It would take me the whole hour to mention everybody on the team. So thank you so much, and I hope to see you on Saturday. See you in a metaphorical sense.
Yeah. Thank you, Linda. You worked so hard on this for 6 months. This is what most people don't realize, that these conferences take so much effort. Many of you do know that, but you've worked super hard for 6 months to make this possible. And we deliberately decided to go forward with it at a time when all the conferences were being canceled, because we wanted to show what we can do online and what we can all learn online. So I'm going to let you go, because I know you have a lot of things to work on. And please do let me know when we're chatting again. I'm sure I think we have a conference call at 9 o'clock today. So I'll let you get back to it, and I'll introduce our other guests. So thank you very much, Linda. Everybody say goodbye. She's at Wordwhacker on Twitter, a wonderful editor, writer. Please follow her and watch what she's doing online. She's amazing. Just to explain Wordwhacker for a second.
Oh, because that was from the days when we were having cute Twitter handles, because all the 3 and 4 letter and 5 letter handles were gone. So I'm an editor. So what do? I'm a writer. So I work with words, and it sounded really cool. I now probably would just say at Linda Bernstein, but it's taken off. It's what my Twitter handle is. And I guess it's okay. Thank you, Sree.
Okay, thank you. Bye, Linda. We'll see you soon. Bye-bye. All right. Thank you, everyone, for being with us. I see various folks have been sharing these posts so that people can join us. We seem to have some kind of shortwave radio action in one of the signals somewhere, but that's okay. That adds to the surrealness of today's moment. Hopefully that'll go away. Let me introduce our panelists properly to all of you. First, we're going to go to Sujana Chandrasekhar, Dr. Sujana Chandrasekhar. She runs, she's an ENT, and she runs her own company and is part of a big practice, but is also president of an organization that had thousands of members. And so she is very much attuned to what's happening at the forefront of medical science at the moment. And I wanted her to share a few words before we go to our other guests.
So thank you so much, Sree. I'm really surprised that these PhDs are actually going to be able to willing to talk to you and me, but I'm very glad. So thank you guys for being on. I'm a ear, nose, and throat surgeon, and I work in a huge double specialty group called ENT and Allergy Associates. We have over 200 physicians in the tri-state area. But I was president of the 12,000 member American Academy of Otolaryngology-Head and Neck Surgery, which is a very fancy way of saying ear, nose, and throat surgery. And I think I've used that experience to try to understand public health better. I started my medical career at City College in New York at the Sophie Davis School, very oriented to community healthcare and public health. And I love that it's come round, both in crises like this and in normal life, where we really think of the patient in front of us, but the community as a whole. And I think that's where we're seeing a lot of necessary input right now.
And tell us we started this conversation. I hope to have you on a few days or weeks from now, but we interacted on a Facebook post this morning, and what you said struck me as being really important to share with everybody. And before you get to that, folks, if you're watching live inside a Facebook group, you do need the instructions of what to do are on your screen right now. You need to go to StreamYard.com/Facebook and give StreamYard permission to show us your name and picture, nothing else. Otherwise, it'll just say something like a Facebook user. So that's also okay, but if you'd like to show us your face and name, you have to do one step extra. Jonathan says, greetings from the East Village, where there are still people in the streets. Rochelle says, Greetings from Hastings. So exciting that you're doing a psychology edition. There is a tweet from in Italian. If anyone speaks Italian, can translate that for us. Let us know. Diane says, greetings from Margate, New Jersey, on a block where there is never anyone around except to walk their dogs, which I think a lot of people are seeing. Mark Lee is watching from Durham, North Carolina. And Clara says, so excited to be joining Social Media Weekend virtually. So much to learn and so many interesting people attending. Thank you, all of us who are putting that together. Thank you. We're so excited, Clara, that you can join us. Clara was a guest in Live from Europe edition, and she told us what's happening in Torino right now, where she is. Clara, if you want to post any more comments or updates, I'm sure people would like to see it. And Sujana is watching from in Denver, and she says she'll be back and forth because she is working, as a lot of people are. And let's go to Sujana again to just tell us a little bit more about what are some of the things she's thinking about today.
So, we're in the middle of we're in the beginnings of the crescendo of, unfortunately, what we expect to be a really horrible pandemic that has affected the entire world, has affected all the United States. And we know that even with our best efforts, it's going to get worse before it gets better. We anticipate that it will get better, and we anticipate that we can flatten the curve. So everyone's hearing about flatten the curve, flatten the curve. That means instead of having a whole bunch of horrible cases all at once that overrides the medical care system, where we just don't have the beds or the supplies or the physicians or the nurses or the ventilators or anything, we can actually take those same cases and spread them over time so that we can actually manage the patients as they need care. And the way we flatten the curve is by everything everybody's been hearing, which is wash your hands, don't touch your face, don't shake hands. You can wave at people, you can namaste people. One of my non-Hindu friends said, why don't you just say namaste to people? I was like, all right. You can elbow bump them. You want to make sure that you're not transmitting disease. So stay 6 feet away from people if at all possible. Really protect the vulnerable in your world, which are the elderly and people with underlying health problems like chronic lung disease, people with immune suppression diseases. These are the people who really need to be protected. The 4 of us on this call may get a mild case. We may not even know we have it, but we can, in that time period of not knowing, pass it on and make it a terrible disease in somebody else. One of the things that Sree and I were sort of communicating about earlier was the psychology of your caregivers. So we signed up for this, right? We signed up to be physicians and nurses, and we signed up to take risks with our health that normal people don't take, just like firemen and fighters take risks that I normally wouldn't take. A police person would take a risk I normally wouldn't take. But we signed up with the understanding that that we were going to be protected as much as possible so we could continue to take care of patients. And what we're seeing is in hospital after hospital after hospital, the PPEs, or the personal protective equipment, is running out. So we don't have proper masks. The N95 masks are a special masks that prevent most viruses from entering. We don't have the gowns. We don't have the gloves. We're being asked to make do. My cousin is an interventional cardiologist in Tennessee, and he does catheters and there's blood, and he literally is handed 1 mask per day, a regular mask, a paper mask, not an N95, per day. That's not right. So I think we are afraid. We're afraid of bringing this home to our children, to our aging parents, to our friends who may have lung disease. There's some anger where administrators today and the CDC today said, oh, just wear a bandana. we're not the mask bandits. We are physicians and nurses.
Can I
and
just
we
stop for a
need-
second? Yeah, what you're saying is so important. I just want everyone to just underscore that a doctor, a surgeon in America is talking about conditions that we see in like field hospitals or in, you know, in triage situations that we would never expect in America. People need to understand that. People need to, those of us who have hoarded hundreds of masks need to go and donate some to hospitals right now. And if you have a question for the doctor, please go into your Facebook or LinkedIn right now and ask the question. I'm trying to keep track of all the different moving parts because we're on Twitter, Facebook, YouTube, etc. But please ask questions, and we'll come to her more, with more questions. But please finish your thought, and thank you for what you and every doctor is doing.
Well, you know, it is our pleasure. It is our calling. We're talking about doctors and nurses aides and transport and lab personnel, anybody who interacts with you in a healthcare setting. We love what we do, and we want to be able to keep doing it. There's no benefit in taking out our trained healthcare providers because we don't have a mask. I have to tell you, you know, one of my patients walked in about 10 days ago or so wearing an N95 respirator, and he just freaked out. You know, you can imagine. He probably freaked out everybody on the train. He freaked out everybody in the waiting room. And I walked in and I said, Tim, are you sick or are you just slightly crazy? And he said, oh, I'm just slightly crazy. And there's no benefit to an asymptomatic patient walking around with a mask on, or somebody who's not at danger, somebody who doesn't have like chronic lung disease walking around with a mask on.
Well, people are saying thank you to you, Doc. Thank you so much for sharing. I just want to show people your website so that if they have questions, they can come to your website. Give us the URL.
It's entandallergy.com.
And you have right on the screen a warning and alert around coronavirus.
Yes, and we really want to keep our patients safe. We want to keep our staff safe. We want to keep staying in business so that we can take care of people. I'll tell you, and I'm a physician first, obviously, but as an ENT, a lot of what we're seeing with COVID-19 is the runny nose, the scratchy throat, the fever, the cough. You see a lot of these symptoms with allergies. You see a lot of these symptoms with a cold or a flu. So unfortunately, the data has just come from China that ophthalmologists, so eye doctors and ear, nose, and throat doctors were the hardest hit of the medical professionals in Wuhan, because when we examine you, we're right up in your face. Like we're right in your face, looking at you and scoping you, doing whatever we need to do. So I think use your judgment. Most patients are pretty savvy and they know when to come in and when not to. And you can always call us and we can triage over the phone.
Here's a question from one of our friends on LinkedIn. She asks how to address colleagues who seem less concerned about virus transmission than one thinks they should be, and they say things like, this is not such a big deal.
So one of the problems we've had in the United States in particular is that there has been a political divide as to who believes and who doesn't believe. And that's really unfortunate. Politics should never enter healthcare. And unfortunately, we are seeing young people, old people, relatively healthy people succumb to very aggressive forms of this disease. I think Sree, you had put up the graphic this morning. 29% of the people hospitalized with this are between the ages of 20 and 44. And there's some significant data that even if you get better, if you're sick enough to require care, you may be left with a significant less lung capacity for quite some time after this is done. So it's great to try to minimize something before there's proof, I suppose, but now there's plenty of proof that there's no reason to minimize this. We use something called universal precautions with most patients, which we should, and it's to prevent transmission of disease from patient to patient and transmission of disease from doctor to patient, as well as from patient to doctor. And I think if we exercise proper precautions and have the tools with which to do that, we can get through this. We can flatten that curve, and we can even make the cases as minimally intense as possible.
Minimally intense sounds pretty good right now, and we will take it. Chitachi says the worst thing people did was to politicize and racialize this epidemic, and
Yeah.
I think that's certainly one of the things that we have seen in this particular conversation. Well, one of the questions is, there are talks of at-home tests, and there are talks of all kinds of things you can do yourself to self-care, prevention, all of that. Any of that true?
I just saw something about at-home testing getting closer to reality maybe an hour ago. I will tell you that one of the problems we did have is that the initial tests that were available in the United States were not accurate. Somehow we got a bad batch. And that's a real problem, because if you are infected and you get what's called a false negative, which means your test, whether at home or at a testing center, says you don't have it, that's actually not a free pass for you to go about, getting within a foot of people and hugging and kissing. So I think we're not yet at home testing. We are probably significantly closer to getting tests with results within a few hours as opposed to 5 to 6 days. We are still physicians. I belong to a lot of physician groups, and we're having a bear of a time getting patients whom we know need to be tested actually tested. So that's a real issue. Essentially, you need to act as if you are positive for COVID-19. That means stay 6 feet from people. Don't touch them. Don't share utensils. Don't be hugging people. Wash your hands frequently. Don't touch your face, because you can transmit what's on your hands through your nose, your eyes, your mouth. Those are the most susceptible areas into your body. If you happen to work in healthcare, or you are or in a grocery store and you're surrounded by a lot of people all the time, when you get home, change your clothes, put them in the laundry, take a shower, clean off, and become clean as you start to greet your family.
That's great advice, and thank you. I know you're very busy, so if you want to jump off, you're welcome to.
Oh, I want to
Everyone can
listen.
follow you, ENT space AND space allergy. Thank you so much, Doc. If you want to stick around and are able to maybe answer some questions in the Facebook group, you're welcome to do that in the Facebook comment section. Otherwise, you're welcome to listen in and participate and maybe ask your own questions of our next 2 guests. So let's bring them in, okay? So we just want to say thank you in case you have to jump off at any point. Thank you very much, Doc.
Thank you so much for having me. I really appreciate it.
We really appreciate Dr. Sujana Chandrasekhar for joining us. Please check her out on Facebook and on her website, entandallergy.com. We wish you the very best, and all your colleagues, friends, nurses, orderlies, administrative staff, everyone in the healthcare system is a frontline worker, and we're so grateful. Thank you.
Thank you. I'm going to say one more thing. If
Yes.
you talk to your legislator, send us PPEs, personal protective equipment. Allow us to do our job, because we want to take care of you.
Personal protective equipment, PPE. When you said that this morning, I had to actually look it up, which tells you it's not penetrated our consciousness. So now it will. PPE, personal protective equipment. Thank you very much, Doctor, and namaste, because now we can spread our message from our part of the world and our culture. So thank you. Let me introduce our 2 other guests who are here today, who have kindly taken time from their day to be with us. They are Jeff Gassen. Jeff, if you'd wave. Jeff is at TCU. He's, I believe, a graduate student. Is that right? Yeah, I was going to give you a promotion to professor, and so maybe in this, like you have wartime promotion, maybe we'd give you one. And you should get one just for matching my clothes colors, even though you didn't know, like the perfect.
No, I knew.
You knew. That's right. You psychology folks are a little scary that way. And also, I want to introduce my friend Athena Aktipis, who is a professor at Arizona State. So grateful to both of you for being with us. Do you want to, Professor Athena, do you want to just start us off? Tell us why we're here, why the psychology of all of this is important, and you're doing something unusual apart from your teaching, your research. You and Jeff decided to have some fun as a way to be helpful.
Yeah, well, I'll just start by introducing myself in general. So I'm a professor in the psychology department at Arizona State University. I also co-direct something called the Human Generosity Project, where we look at how people help each other in times of need, including times of disaster. So we actually have a new research project that we started to look at how people are cooperating during the pandemic now. And I also am the chair of something called the Zombie Apocalypse Medicine Meeting, which is really all about how do we work together as an academic community to understand the risks that we're facing and how to better deal with them. So that's been a really important part of what I've been doing over the last few years. And I also have a podcast called Zombified, which is kind of an extension of that conference. And I have, over the course of the last year or so, been getting more and more interested in how we communicate, how we talk to each other, how we use not just sort of the standard ways of communicating in science of, giving a conference talk and publishing a paper, but how we can really bring in other ways of communicating, like having conversations where it's okay to speculate, where it's okay to acknowledge that you don't know something. And so a lot of what I've been doing with the podcast has been that. And one of the things that I've gotten even more interested in the last few months is comedy. And for a very, very, very long time, I didn't think I was funny. I think it's mostly because my husband wouldn't laugh at my jokes. And I realized that he just doesn't laugh at jokes in general. And I got a little bit more interested in trying out my hand. So I did like my first comedy set a couple of months ago at a science writers meeting about the zombie apocalypse. And it actually went well and I enjoyed it. And so then when Jeff and I, we were actually on a visiting a field site with the Human Generosity Project. So Jeff is helping with some work that we're doing, actually looking at the Cajun Navy, who are this group of amazing men and women who live in the Gulf Coast area, who have boats. And when there are hurricanes, they go and save people for, putting their lives on the line, often spending their money to do it. So we were there interacting with these amazing people. And we were getting ready to go to a psychology conference that was right after this time. So we're having this great time meeting with these people and really kind of being in it and just how real, it is to be present with these people, as opposed to like studying things in a lab. We're about to go to this conference where everybody studies things in a lab. So we were kind of joking around about, how academics often were just so absorbed in our own methods and our own way of doing things. And we thought it would be fun to start a satirical news organization, kind of like The Onion, but for academia, where we could, in a, lighthearted and fun kind of way, give some of our opinions about things that have to do with, peer review or how academics, sometimes don't look at the big picture. So we started this.
So I'm showing it on screen right now.
Here we are. Yeah. So Reverse Psychology Today. It is a way that we found initially really just to kind of have a little bit of fun with some things that we thought were frustrating about how academia in general operates, and also just to be funny for the heck of it. We don't necessarily always need a reason, but as things have developed over the past weeks with the COVID pandemic, we have found that more and more, Jeff and I are texting all hours of the day and night with ideas for these stories. And we, write them on a Google Doc, and then we, put them up, and then we put them out on Twitter. And some of them have gone sort of viral. We wrote one very early about how professors were panicking because unnecessary meetings were getting canceled, and that, that let them know that maybe there's something actually going on in the world that they should pay attention to. And so really our spirit has been to be funny, to kind of call attention to the fact that there are a lot of really important things that go on in the world that are outside of academia. But at the same time, it is our world. And, we all are, experiencing things like transitioning to working at home now. And that has implications for us as academics. So one of the recent articles that we published was that professors are wishing for the email apocalypse. Because, of course, we're still getting all of these emails. We can't possibly keep up with all the emails. We're even getting more emails. And if only email servers would all go down, then, we could have a little rest. Of course, it's tongue in cheek, because it would be horrible if email went down, because then we couldn't actually do the things that we need to do. So for us, it's really a way of having a laugh and entertaining ourselves, but also, there's a little bit of social commentary in there as well. So for us, it's been really fun. And Jeff, I have had so much fun working on these with you, and texting our ideas and working on Google Doc, and So
thank you. So it's called Reverse Psychology Today, right?
Yeah. So Reverse Psychology Today. So there's a totally legitimate and wonderful site called Reverse Psychology, or called Psychology Today, and we decided that we would sort of parody that, and we're hoping they won't sue us.
Well, but reverse psychology is a real thing, so why would they sue us? Sue you? I'm already taking credit for it, and the Twitter handle is Psych News Today, and
it's at Psych News Today is the Twitter handle.
So I want to hear from Jeff about the how this is all coming together, but I do want to ask you, Professor, what as you hear about these kids and young people not believing all the problems around COVID-19, is there reverse psychology we could use to get them to pay attention?
One of our articles from a few days ago is that denial is the best protection against COVID-19, which of course is not true. If you deny your own vulnerability, that doesn't protect you. In fact, it might do the opposite. But I think there's a lot of really important work to be done in sort of the psychology of how we approach disease. That's not my specific area. I know that Jeff also works a lot more on disease than I do. My main area is really looking at cooperation and how people cooperate in times of disaster. And I'm interested in many different aspects of sort of medicine and human health. But in terms of, what is it that we can do about the psychological denial? At this point, my main weapon for that is humor.
Yeah, I hear you. Sujana is trying to find Zombify on podcasts. Is it listed under something else?
It's Zombified.
Zombified. Okay.
Yeah,
maybe you can jump into the Facebook comments and maybe post the link while we get Jeff to share his thoughts. And welcome, Jeff, to the show. And
thanks for having me.
Joining us. Where are you, by the way, right now?
I am in Fort Worth, Texas, and I live right next to a couple blocks away from Texas Christian University. And so I'm
a great academic and sports institution, right?
Yeah, absolutely. So I'm quarantined, but only a couple of blocks away from where I typically spend all my time. So it's not a lot has changed, honestly, for me.
Tell me about reverse psychology today.
Yeah, so it came about really organically. I too have sort of more of a failed history in stand-up comedy. I used to do a lot of open mic nights when I was in my undergrad. It's a really small scene in Omaha, Nebraska. And, Athena and I, we always crack jokes and stuff. And we were on this research trip, and we were talking about how this conference was coming up, and we had similar thoughts on different facets of the conference, things we liked, things we didn't like. And then we kind of just sort of coming up with these ideas like, what if this happened at the conference? What if that happened at the conference? Wouldn't that be hilarious? Wouldn't that just either confirm our preconceptions or totally change our minds about going to this conference? And then it sort of grew into this website where we had all these ideas for stories. And then we thought, hey, we'll use this conference as sort of a period where we can kind of float these things out and see if everybody else thinks what we have to say is funny. And then, so we met every night during the conference. We started writing articles, and some people liked them. Some people probably don't, but they don't say anything, so not worried about them. And then so we kept doing this after the conference, and then the whole COVID thing popped up, and not necessarily forcing it, but then just because that's, the forefront of everybody's minds, or if it's not, it should be. Those are our articles sort of drift toward that topic, and that's kind of where we're at now.
Okay, thank you very much for sharing that. How often are you publishing? Are you getting any media attention to this? And remind people how they can find this.
Yeah, it's you can find it at reversepsychologytoday.com. Our Twitter handle is at Psych News Today. There's also a Facebook page under Jimmy Bill is the name of the founder of Psych News Today.
What's his name? Jimmy?
Jimmy Bill. Yeah, Jimmy Bill.
Yeah, it's our pseudonym for.
Yes, of course.
Because we're not putting our names on the web associated with this, because it's not we're not doing it in any official capacity as part of our institutions. It's purely a side topic that we're doing in our free time, not associated with our professional situation.
Yeah, we're more curators.
You're making that very clear, so I appreciate that.
Yes, these thoughts do not reflect our institutions. We're more curators of the mind of Jimmy Bill. He thinks of things.
Does he have tenure? That's the most important thing. Does he have tenure?
Yeah, he must. Otherwise, he wouldn't be so brazen.
Alicia Marie says, I had 3 conversations in the last 24 hours explaining why to take COVID-19 seriously to people who still aren't getting it. What do we do, folks? You're the experts in psychology, reverse psychology, something else. Tell us what is our message to our friends, family, and others who are just not getting it.
Well, I'll jump in here and just give a couple of thoughts. This is one of the rare situations where something's going on out in public, and scientists are, instead of being the ones who are sort of downplaying the seriousness and trying to sort of reduce the hysteria, they're actually saying, hey, this is a serious problem. This is something that's going to get worse before it gets better, and we all need to take this very seriously. We need to social distance. We need to, not go to conferences, do all these things. And often it's the other way around, right? Where scientists are saying, hey, this is not that big of a problem. Don't get too worked up about it. Don't go on WebMD and think that you're, have cancer of the ear or whatever. But I think that's telling of how serious the situation is, that those who are typically very sound mind and don't like to play up the seriousness or of anything are really emphasizing this is something that, is really serious we need to worry about. As far as sort of getting everybody else on the same page with the seriousness of this, I think that using social media has helped a lot of people. I know that a lot of Facebook friends and Twitter friends that I have weren't taking it seriously until they had a hashtag they could attach their thoughts to, and the next thing you know, they're like, hey, let's separate together, let's flatten the curve. So I think that's been helpful. I think still just I think it trickles down from administration down too. So now that I think the U.S. government is taking it more seriously in press conferences than maybe a month ago, that's helped a lot as well. But still, there's still, wide gaps in some people's beliefs about the seriousness of this pandemic and how serious it actually is.
Yeah, I just got, I like to sign up for right-wing conservative media emails so that I can see kind of the extreme viewpoints. And I got an email today saying Dr. Drew, the famous, I guess he's a psychologist or psychiatrist from TV guy, talking about how no one should panic and it's all overblown by the media. He said that about 8 days ago, but he shouldn't have said it then. But the right-wing media is now using it today to kind of send that around and say how the media is lying about everything. And so that's one of the problems that we clearly are encountering right now. Sujana says, thanks for posting. She's found you on Twitter, Athena, and she wants to learn more about this, about the psychological dynamics. App Grooves is running a story I wrote about how businesses are adapting. And I'd like to talk about more psychological dynamics and apps that can be used to help people, people survive. So I hope you'll connect. Athena, Sujana is a wonderful writer, and she has a stay home banner on her Facebook. So she knows to take this stuff seriously. So Athena, I hope you will connect. Folks, we have about 15 minutes left. Please jump in with your questions and comments. We're on LinkedIn, Twitter, Facebook, and part of the reason I'm doing this every day is because I learn so much every day. Mara Gullens, one of the people who watched yesterday, said, Sree, thank you for doing this. The conversation was uplifting, and it really is uplifting for me. And I plan to do this every single day because it's important for us to connect. Professor, can you talk a little bit about the importance of how we connect, because, you know, some people are objecting to the word social distancing. It's about physical distancing, but we can be connected using these tools in other ways.
Yeah, sure. Yeah, there's a great article by Nicholas Christakis about exactly this, that we should be not distancing ourselves socially, just physically. And in fact, I think we've seen a lot of people reaching out over the phone, over Zoom and other video conference software to connect to others. And we've also seen, I think, a really interesting movement happening via social media in terms of new social norms. So, you know, I study cooperation, and there's a lot of cooperation that's important for helping us to reduce the severity of the pandemic. And so there's actually a fundamental social dilemma that we're all kind of facing now. And some people might be familiar with the prisoner's dilemma or the tragedy of the commons, where, you know, one person can cheat and then that can have a bad effect on everyone. And this is sort of similar to that, but it's also a little different. This is actually what's called a volunteer's dilemma, where you have to have a certain number of individuals sort of volunteering to do a certain action in order for everyone to be safe or protected or okay. And that's kind of the situation that we're in now. So so I think there is definitely an element of cooperation that is important to having us all sort of have solidarity in terms of approaching this in a way that will reduce the severity for everyone. So, you know, we can cooperate by doing that. We can connect to each other by finding these opportunities to use the technology that actually allows us to connect in very direct ways that allow us to bridge that physical distance and still have that social connection. So I think that this kind of event that Sree, you're putting together over the weekend, and having these chats every day, and people just, you know, instead of emailing somebody, why don't you have a Zoom call with them or a FaceTime, so that you get that sense of physical or of social connection, because it's extremely important for all of us to feel okay. You know, we are fundamentally social creatures. We evolved in, you know, social groups where we had contact every single day with others. One thing that I think is kind of interesting, though, is that, you know, right now we're in sort of smaller groups, right? We're in, you know, maybe we have a few roommates or a few family members that we're interacting with. And I think there's also opportunities to really strengthen those bonds and have really important moments with the people who we're closest to. So I think there's a real opportunity there. And I've also observed that right now, because for the most part, people are not gathering. There's not parties. People aren't going to bars, right? Most people are not doing those things. That there's actually not a sense of FOMO, right? You don't have a fear of missing out.
Right.
You're going home because everybody is getting home.
Yeah, no, everyone's missing out. So there's nothing to miss. Is
Exactly. And so I think for me personally, it's also a chance to think, okay, well, what are the things that, I have been doing and that we've all been doing, or that, in academia we've been doing that, maybe, we have a chance to think, well, why are we doing those things? Why do we gather in such large groups? Do we really need to have a conference every year for this? Or, and I'm not saying that we shouldn't, but I'm saying it's a chance for all of us to sort of rethink all of that social inertia and sociological inertia around all of the things that we do, and think, well, what do we really value? What do we really want to do? And as we sort of get a sense of the new normal with this, and then after there's some, return to us being able to gather in large groups, I think we can be more intentional about it. So I think there's some hidden opportunities in all of this for us to be thinking really about, what do we value? How can we strengthen the bonds that are important to us? And then, when we do start gathering again, how to be more intentional about that.
Folks, please follow at Athena Aktipis, at Jeff Gassen, and ENT and Allergy and Wordwhacker. These are the folks who you met today. We've got a few more minutes left. We've got some more questions and comments coming in. Jeff, what do you think about what we were just talking about? Also, we didn't get a chance to hear about your own work. What are the things you're studying and working on?
Yeah, I think Athena's spot on about everything. I think to summarize what she said, we can probably live with fewer meetings once we get back together. So anybody who's listening to this, I think we can reevaluate the number of meetings we have. So I'm an experimental psychologist. What that means kind of differs day to day for me, but I do a lot of research on early life stress, health, immune function. My dissertation work that I'm going to have to defend here in a couple of weeks via Zoom, of all places, it'd be kind of a strange situation, is on sort of the destabilizing influence of infectious disease on cooperative structures sort of across countries. And then in the lab, how do people's immune systems sort of influence their tendency to cooperate in different situations? And so it's kind of a actually timely sort of topic, even though I came up with it over a year ago.
Wait,
so,
you
yeah.
only worked on it a year before you got to defend it? That's pretty fast in academia, isn't it?
Yeah. Data collection was, pretty frenetic pace. But,
wow, that's pretty.
Yeah. We got a lot going on.
Memo to everyone: go apply to TCU to get your faster master doctorate.
I don't. I wouldn't. I mean, I absolutely do apply to TCU, but I wouldn't encourage you to try to get all your data collection done in a year. But I had a postdoc coming up, so I thought I was going to have through the rest of the summer. But I'm starting a new job here.
Oh, you are? Okay. Well, congratulations on that. Let me ask both of you as academics before we go to some more comments. How do you think academia is going to fundamentally change, if at all, by this? Our guest yesterday, Andy Revkin, please go back and watch his fascinating conversation yesterday. He said everything we know will change at least a little bit, or will have changed. How do you think academia will change?
I think there's going to be huge changes. I mean, already many conferences for coming up over the next few months and the summer have been canceled. We wrote an article in Reverse Psychology today that satire about how the peer review system is collapsing because people have better things to do with the apocalypse going on. It was satire, but I do think that there are challenges that peer review system and the publishing model already has. So it's possible that this situation will put additional strain on it and force us to rethink a little bit about how peer review works and how the publishing model works. I think teaching, there's going to be many more opportunities for teaching remotely. ASU has moved entirely to online teaching for the remainder of the semester. I know a lot of other universities have done that as well. And so I think there is actually an opportunity for sort of exploring and showing that method can be effective. And as it is shown to be effective, I think there'll be more opportunities for that. And also just telecommuting in general. I mean, I know a lot of professors already, work sometimes from home, work sometimes at work. But I think that for much broader range of people in academia, probably telecommuting will become much more of an option. And then conferences, of course, that's going to be a huge shift. And whether we have as many conferences and whether they're as large in the future, or whether that is rethought and we have more online meetings, I think that'll be really interesting to see. And I do suspect that this whole situation will actually provide an opportunity for developing technology that's effective for having remote meetings, or more effective than what we already have for remote meetings. So that will, I think, add new opportunities for how we can have remote meetings even after the threat of the pandemic has passed.
And I do want to point out that your ultimate boss, the president of ASU, Michael Crow, when he was at Columbia, was a pioneer in all of this, in remote learning. He was doing that 20 years ago and pushing us very hard. I don't think we were all ready at the time, but that's why I think maybe ASU and some other schools might be more prepared than some other schools. Quick word from a student point of view. In Jeff, you've left that. You're about to have a full-time job and all that, but you're still very close to students, I'm sure. Tell me how this is affecting them. How are they thinking, etc.
Yeah, that's a great question. So I think the initial sort of concern for grad students, at least, was that if our classes are moving online, we're not having teachers or to be teaching assistants, are we still going to get our stipends? Of course. But it's it's from a social standpoint, we spend 40 to 60 to 70 hours a week in a room with some of our peers, and then you go to not seeing them at all. I mean, we still have some like happy hours via Zoom and things like that, and a lot of times these conferences are the only chance we have to go on vacation, get out of town, go see friends at other institutions. So that kind of presents a challenge. But I think that, if it's never a good time to have a pandemic, of course, but given that, we have, social media, we're able to still communicate with people. It helps. Zoom, all these things have been great. And just being, keeping up the morale of students. I know that it's been tough to sort of, for me and for many other people, to analyze their data and write it up for dissertations or papers because we're locked out of campus. A lot of the statistical software we use is very, very expensive, so we don't have access to that. TCU and I think some other institutions are working on getting remote access to some of those programs, but that's been a big challenge and sort of hurt some productivity. And I do think that Athena's right that this situation is kind of going to force our technological hand a little bit, in that some of the sort of improvements in online course formats, improvement in maybe virtual conferences, things like that are going to have to happen. Otherwise, maybe they would have taken longer to sort of get underway. But now we're just going to have to start optimizing those different frameworks.
Thank you. So I just want to share a couple of more of the comments that have come in and some of the questions. We also have our doctor is back. As I said, we have 3 doctors now on the show. Only one of them is a medical doctor. And Alicia says she loves how humor is being used to tackle tough topics. Mara says how great it is that we're connecting the shows from day to day. And Raghu has asked a good question that I'll of the doctor. How to handle, maybe all 3 of you, how to handle people with mental illness, especially schizophrenia, he asks. Doc?
So I think that's a great question. I saw it on the feed and I was thinking about that. Many of the psychiatrists and psychologists I've been talking to have incorporated successfully telemedicine into their practices, even into some of their groups. Which is really terrific, particularly the psychologists who are working with college students who are, as you said, very comfortable with online communication and very comfortable with online learning. There are degrees of schizophrenia, so a well-controlled schizophrenic, a functional schizophrenic who needs their meds and needs counseling can be incorporated into that if they are willing to do so. Because that kind of care can still be very personal and very helpful. If they are somebody who needs much more intensive therapy, then that has to be done again with the physician and the psychiatrist and the psychologist being protected, the patient being protected, not waiting in a waiting room where there may be people who are infected. But we can do that. Even in non-psychiatric medicine. The Centers for Medicare and Medicaid, which controls all of physician payment in the country, has approved telemedicine, has approved the coverage of telemedicine during this COVID pandemic, which is amazing. Hello, dog. Which is amazing because that means that if you have a cold or you have a neck ache or you're worried about a rash, you can telemedicine with me, with your physician, and we can actually provide care to you without you having to physically enter the world. And I love the concept that it's not social distance, it's physical distance, because socially, my son and I just took a yoga class online today because unfortunately all my surgeries were canceled because we're trying to conserve resources and protecting our anesthesiologists from having to intubate people who might be sick and therefore getting sick themselves. So, you know, I found that I went from my panic state to my, let me figure out how to make lemonade or maybe even limoncello out of these lemons that we've been handed just now. And I really appreciate that concept. We're not socially distancing, we're physically distancing, but there are different ways to stay connected socially, even through this.
Sure. Well, thank you. That was wonderfully put. I brought out our dog, who I might be traumatizing by having her on the show. She's doesn't like sitting on people's laps. Well, a lot of us think of animals as kind of being happy to sit on our laps and, you know, all of that. But this gal does not. Her name is Tara, T-A-R-A, and she has her own Twitter feed, Instagram feed, sorry, the.tara. Hope you will connect with her. Rupa, my wife, who is next door in the living room, she says she likes all the panelists, but she's particularly partial to Tara. And Mark, who has his own podcast out in Durham, North Carolina, says he would love to have each of you join his podcast in the weeks ahead, days ahead. So part of the reason we have the show is to show journalists who are watching all these interesting new folks who may not be on their radar. And Athena, I want to tell you that Nicole Breskin writes in LinkedIn that her worlds are colliding because she didn't know that we knew each other. And now she says Athena and Sree colliding is great. So I really am glad that we're able to make these connections, and it shows you the value of digital for things like this. So before we go, a couple of quick things. One is to remind everyone that Social Media Weekend is on Saturday all day, and it's on East Coast time, but it is live and recorded. You don't have to sit there for 7-8 hours and to participate. It's all recorded. You can go and get tickets at smwknd.com. So it's very easy to find. If you can't afford it, please write me a note privately, and I will give you a free ticket because I want everyone to benefit. If I had the funding, make this free to everyone. I mean, my eventual goal is to be able to do training like this on a global scale without charging people money. I hate charging people money. I want to charge institutions, I want to charge organizations, etc. But we have to do what we can. And my team has worked so hard for 6 months, and you're going to learn a lot. It starts with a brand new keynote from me, and then Jeremy Kaplan, who is a great expert on tech, is going to do his famous workshop. We're going to have workshops on everything from social media fails to how to use TikTok properly. We're also going to have a guest from LinkedIn itself to help us with LinkedIn. Junte Delaney is going to help us with personal branding and your digital branding and what you need to do. And finally, Nick Kristoff and Cheryl Wu Dunn are going to join us for an amazing conversation around their very timely book. It's called Tightrope: Americans Reaching for Hope. And that is, again, on Friday. Please join us. Tell your friends. I can give you a discount code if you need one. Just email me, sree@sree.net. And before we go, we started to think about this yesterday, about the importance of a moment of being calm or mindfulness. So I don't know if any of the three of you want to lead us in the mindfulness. I'm going to give you a chance if you want to do that. Otherwise, I'm going to do it. Athena, any interest, or Jeff? Okay, so Athena's going to lead us in the moment of mindfulness. All right, so go ahead.
All right, so this point, I want to invite you to take a deep breath in And exhale. And again, breathe in. And this time as you breathe out, let go of any stress that you're hanging on to. And now breathe in again. And again, breathe out and let go. And now we're going to do one last one. We're going to breathe in, and then we're going to all have a laugh. Breathe in.
I feel like we should be covering our mouths for this.
Oh, that's right. That's absolutely right. Or yeah, coughing into your sleeve. That's right, Doc. Look at that. Always on brand there, Doctor. Thank you. So let me thank.
Should we be laughing?
Yes, absolutely fabulous. We're going to let Tara go before she kicks me in the face. There's not a good moment to have any deep cuts that need, going to the ER for. But let me thank Dr. Sujana Chandrasekhar. Thank you so much for being with us. You and your colleagues are heroes, and we want to thank you for making the time today and being with us here today. Thank you very much. Namaste to you. I want to thank Jeff Gassen, who is newly graduated Dr. Gassen at TCU. He's about to. Sorry, yeah, you're about to defend your thesis. We don't want to jinx it, right? So you're not ABD. You've done the dissertation. It just has to be defended. I don't know if there's a shortcut for that. Is there, Jeff? Is there a?
I think ABD is probably still the way to go. Yeah.
Okay, but you're about to be. I know you'll do it, and you might be one of the first in the world to do it by Zoom in this particular cycle. So at least among the first. And so we wish you the very best and good luck. And I hope you will keep in touch beyond this. And to Athena Aktipis, thank you so much, Professor at ASU, for bringing me into your world. And we were going to meet in April, and then we were going to meet in October, and none of that may happen, or all of it may happen, but digitally, we don't know. And that's one of the things that I think is so important for everybody to say. We don't know. And we want to thank both Jeff and Athena for starting reversepsychologytoday.com, which is a wonderful, fun website to fight disinformation with humor. And that's really important. Now, tomorrow I have a terrific show at noon, different time, noon Eastern, because the rest of the evening is going to be prepping for Saturday. We have our 8th show, and it's going to be about travel and media. And among our guests are going to be Rafat Ali, at Rafat, R-A-F-A-T, who runs Skift, S-K-I-F-T, the most important travel business site in the world. And we're going to be joined by the CEO of Muckrack and the founder of the Shorty Awards, Gregory Gallant, who's at Gregory. And we're going to talk about media and events. These are two critical industries that are being, kind of disrupted in ways no one could have predicted by this pandemic. So we're going to talk about that tomorrow at noon. And I'm going to do this every day, including Saturday, Sunday, and for the foreseeable future, because I want us to come together. I want your guest ideas. I want your feedback. Please email me, sree@sree.net. Tag me on Twitter, Facebook, whatever. We're going to be here. Thank you very much, everybody. Please stay safe. And if I can help you in any way, reach out to me. Thank you very much. And we'll say goodbye to everybody.
Thank you.
You can just leave the studio, folks. Thank you very much. And I'm just going to, bye-bye. Actually,